Then he could recognize, that's what happened. Did you go for a bone marrow transplant or something like that? That no, I'm just doing diet, nothing else. Fruits, vegetables, fruit juices. Because she had tried everything, almost all drugs and progressive MS. So she reversed quite well. And that's what happened to Terry Walls also. But these are all anecdotal cases. You can't generalize, So then, you should not stop medicine and go for diet. So it's not like that. But when you add multiple dimensions to the therapy, it makes a big difference.
So yesterday we had, day for yesterday we had Alzheimer's and dementia.
World Alzheimer's Day.
World Alzheimer's Day, 21st.
Yeah.
And so there were some questions, like people were saying that if you move your tongue like this, it's supposed to, improve the memory and other things.
Walk backwards.
Yeah, so all that. So the people who are having some experience, they were saying that there's no harm in doing it. So you can do it.
Correct.
So,
Not in public. Not in public.
so like what you're saying, these diets and all those things, they're not going to do any harm anyway. So,
Correct. They're anecdotal cases. You can't generally, you can't say that it's a medicine, you take that, it works.
But they can always try it along with one another.
Yeah, true. So we lack evidence in many of these things, but just lack of evidence doesn't mean that it is not there.
Right.
So we in clinical practice we have class 1, class 2, class 3 and class 4 evidence. Class 1 is something which is based on RCTs. So for a drug to get approved, it has to go through a RCT. So rituximab is a typical medicine which will never get an approval because it cannot go through an RTC. Companies don't make profit. Whereas ocrelizumab, which is exactly like rituximab, got accelerated approval in few months. Was exactly similar. And they are going to market it in India now. So I told those company guys, we'll not write ocrelizumab. We already have a better drug at 1/10 of your cost. Yeah, fine. So let us have something to eat, Rani ji. Busy idea. Yeah. So before that, you met Dr. Aishwarya, right? So she is going to become a doctor. She's a Gujju. So she is studying MPhil, right? Masters in neuropsychology at Christ University.
She said Telugu.
Telugu? No.
I can speak Telugu.
Yeah, but she will speak in Gujarati. Ki soche, like that. So chocho. Okay, whatever. So she can help us with improving the brain volume. So I given her some task to do SDMT. So there's a form she has taken print out. If anyone wants to try how your cognition is working, she can. What you're going to do in this?
So as you can see, from 1 to 9 there are numbers, and below each number there are distinctive symbols there. So 1 has different symbols, 2 has different symbol, 3 has different symbol. Below that you can see 4 rows too. Each row has 1 to 9 numbers. So you have to see, as 1 has the dash symbol, so where 1 is mentioned in the row, you have to put the dash symbol. And for the 3 you have to put the square symbol. All the rows you have to fill with the symbols mentioned above to the corresponding numbers. I can show you a demonstration if you'd like to have it.
But yeah, after the break, huh? So let's try. Whoever wants to try. Let's see how our brain works. I will not try. Come, please join. Yeah, come.
And on behalf of all of us, we'd like to thank you for all these years. I was just this morning, honestly, I was just thinking that without your support, I don't know how we would have survived. So let's give a big round of applause.
Shashi has made one more discovery. He got us one guy from Redcliffe. So Redcliffe is a lab which runs in US, UK, and now they are into India. So that guy has offered us good rates for our investigations. So maybe we can use it if required to do those investigations. Come. Yeah, please. Yeah. Whoever can go, please go. Yeah, please help yourself.